good catch. Go, 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 go. That was a good catch. Go, 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 go. That's a good catch. Go, go. That was a good catch.
Hello, and welcome to another episode of Inside Lincoln Hospital, the heart of the Bronx. Today, we're going to be talking with the Chief Medical Officer of the New York City Health and Hospitals at Lincoln, Dr. Lewis Marshall. We'll discuss what led him to a career in healthcare and all the latest updates at Lincoln Hospital. I'm the Dr. Bob Lee, and this program is brought to you by BronxNet's Media and Technology Studios in the South Bronx and New York City Health and Hospitals, Lincoln. Dr. Marshall, thank you for letting us share in the space and time with you. I have to ask you to start. Can you tell us a little bit about your background and what initially drew you to the business of healthcare?
Yeah, and thank you, Dr. Lee, for inviting me here this afternoon. I'm happy to be here. So I think what drew me to healthcare was my family. My family was involved in healthcare. My father was an Army doctor, so we moved around a bit. Yeah. My mother was a social worker. Both of them eventually taught in medical schools. And I also had some older great uncles that were physicians as well. One of them I have a picture of who was Joe Lewis's ringside doctor.
Wow, all right.
And so I think that's what really drew me to healthcare.
Yeah. Any one person in particular, your mother, your father? Probably
my father, yeah. I think that he was really a role model, taking care of patients in the community and really, sitting down and listening to patients. And I think that's really what helped.
You said, Dad, can I help you out? Let me roll up my sleeves. And
I did that.
You did that?
I did that, yeah. Rolled up my sleeves and went to his office, yeah.
That's great.
Yeah.
What are your key priorities as Chief Medical Officer, and how do they align with the organization's strategic goals?
So I think there's several things that we're looking at, and I'm looking at as the Chief Medical Officer, and one is safety, right? Patient safety. We want to make sure that we're providing safe patient care. Second is quality, and to make sure that the quality of the care that we're providing is excellent. So safety, quality, satisfaction is really important, right? We're taking care of people. And we want to make sure that we're providing these people with the care that they want and the care that they need.
Yeah.
And so we want them to be satisfied. But we also want the providers to be satisfied, because if our providers and our workers are happy and healthy, they'll take excellent care of the patients. And so those are our priorities. And I think they align directly with the mission of Health and Hospitals Corporation in terms of providing quality, safe access to care across this whole city.
And when you mentioned safety, is that while the patient is in the hospital?
Safety while the patient is in the hospital, outside the hospital, if we can do safety issues outside the hospital.
Creating the awareness that this is what you need to do.
Right. For example, we have our trauma program goes out into the community and works with community-based organizations to educate people on trauma and reducing trauma.
And then you mentioned quality within those things that you mentioned?
Yeah.
You said the safety, then you said quality.
Safety and quality, which are kind of at the same level, right? Yeah. But making sure that the care that we're providing meets the patient's needs and is really state-of-the-art care that we're providing.
And you serve an underserved community. Can you tell us a little bit about what the patient population is?
So South Bronx has a very underserved population. Primarily, most of our patients are Hispanic, about 50 to 60%. I think about 40% Spanish is the only language spoken in the home. But we're also seeing an increase in the African community growing in this neighborhood as well. So we're also having to look at our translation services and making sure that we can provide care in the patient's language so that they understand it.
And a person who has a green card will have no problems coming into the hospital. Do you have somebody to translate? And all of that is right there.
We have 24-hour translation services in the hospital, and you don't need a card to come in.
Yeah.
We will take you without a card. We don't check your immigration status or anything. We will just take care of you.
You know, the reason why I mention that is because when you're in the community doing a lot of things like, just delving in, people have those concerns.
Oh, absolutely. I think we're starting to see a little bit of that in terms of a reduction in some of the visits to our practices.
Yeah.
Because people are concerned.
Yeah.
Yeah.
What specific initiatives has the hospital implemented to improve access to care for these populations?
So we've done a couple of things which I'm really proud of. One of them is we've expanded our practice hours to include evening hours and Saturday hours, because while we serve an underserved community, that doesn't mean that they don't have jobs, right? So we need to make sure that we have access for everybody. So expanded hours. We also have put in a program last year in the emergency department where people with toothaches and complaints of mouth problems, they go to the emergency department. But we didn't have anybody there who knew dentistry. So now we have a dentist and a dental resident in the emergency department 5 days a week, 8 hours a day, and we're probably going to take care of about 2,000 patients in a year that come into the emergency department with dental complaints. So we can do procedures, we can do extractions, we can set them up for further care. And that's really just a wonderful program that's come up. We've also we started and expanded a pediatric dental program, which we never had before. Because as you know, dental health is important, especially for our children, in terms of making sure that they have healthy teeth as they grow.
What are some of the major health issues besides that people are concerned about in our community?
So we see a couple of things. So heart disease is a big one, and some of that, and diabetes, and both of those are maybe related to obesity as well, or obesity may be a component of that. And also lung disease, right? The South Bronx has a huge number of patients who are exposed to pollution and fuel exhaust fumes. The Cross Bronx is a big place. Back in the late 90s, I was the medical director for New York City Fire Department, and we actually had a big asthma project here in the South Bronx. And we brought in a bunch of people into a park and started educating parents on asthma care and how to care for their children when they're having an asthma attack.
I think I was a part of that. Frankie Crocker sent me out to something like that, and all the kids in the schools in the area had these little pumps.
Yes, yes.
So why do so many kids have these pumps in this area? And I think they were living next to the smokestack over here, the improvement plant.
Yeah, and
so the cleaning plant over here by the Long Island Sound or whatever, whatever that was creating the pollution.
Yeah, and so asthma is a really big issue here. Plus we have, a lot of our community smokes, unfortunately. And so cancer, lung cancer is a big issue too. So we've put in a lung cancer screening program at Lincoln to help identify patients early.
And you mentioned diabetes. I mean, it's so big. Some people are born with it, type 1, and then there's type 2 diabetes where you're not eating right and you're not getting your body's robbing Peter to pay Paul, so you become a type 2 diabetic.
Yes.
What are some of the things we can do, some tips for diabetics?
So the first thing I tell patients is weight loss, diet, and exercise, right? So we have a program called Lifestyle Medicine, which is actually looking at food as medicine and helping these patients, diabetics particularly, learn how to eat. And not only learn how to eat, but learn how to find the food that they need to eat, right? Because if you look at our community, we don't have the best, freshest food all the time, right? You have to go searching for it. So we teach people what foods that they need to look for and which foods will help them with their diseases.
Yeah, I think something that's high on that scale that helps eat up all the insulin in the body is not a good thing all the time.
Not a good thing.
Below, I think it's below 70 or something like that. Mm-hmm. Yeah, there's a scale. Yeah.
Yeah.
The Bronx is among the areas most affected by the opioid epidemic, especially the South Bronx. Mm-hmm. What is Lincoln doing to address the opioid crisis in our community?
So we're doing several things. So one of the things is, I'll start in the emergency department because that's really the front door of the hospital. Yeah. Is when we identify patients with opioid use disorder in the emergency department, we have the ability to start them on medications like Suboxone, which will help them reduce their cravings. And then we can connect them with our ongoing treatment center. opioid treatment center and keep them, hopefully keep them in therapy. So that's one thing. The second thing that we're working on right now, which is new and upcoming and exciting, is our Family Substance Use Disorder program, which is called the RISE Center, Recovery, Integration, Support, and Excellence.
Yeah.
And this program will be for families, like pregnant women who have substance use disorder, their children, their significant others will come in and receive care and support in one area of the hospital. So we're building out a whole area just for this program.
Doctor, that's great to know.
Yeah.
Good information, great information. We've got to take a quick break right here. When we return, we will continue. Dr. Lewis Marshall, Chief Medical Officer, Lincoln Hospital. We'll be right back.
What's up, creative family? Discover your voice with BronxNet community media classes. Are you ready to bring your ideas to life? At BronxNet, we offer television production classes for community members ages 18 and over, empowering you to share your vision with the world. Get certified in field production, in-studio production, and our new exciting addition, podcast production. Once certified, you can create your own show to air on one of our 6 TV channels. It all starts with our free Unleash Your Ideas Masterclass, designed to help you plan your show idea and set you up for success on your production journey. This class is offered at the beginning of each month for your convenience. Our dedicated BronxNet team is here to support, encourage, and uplift you every step of the way. Join us and become a part of the creative force that engages and inspires the Bronx community and beyond. Sign up today and start your media journey with BronxNet. Visit bronxnet.org/education to learn more and register. Let's create something amazing together.
And welcome back. You're watching a new episode of Inside Lincoln Hospital, the heart of the Bronx, with Dr. Lewis Marshall, Chief Medical Officer of Lincoln Hospital. Doctor, it's always a pleasure sitting and talking to you, but I gotta ask you this question. How is Lincoln Hospital integrating new technologies into patient care? What are your thoughts on AI? It's big in our community, everybody's talking about it. And what role do you see AI playing in patient care in the future?
Yeah, excellent question. I think we're all asking those questions. So at Lincoln, in terms of technology, we are implementing some technology that will help us with patient care directly. For example, we are incorporating a robotic machine that will help us with lung biopsies, that will help us identify patients with lung cancer earlier, and then that will allow us to get them into treatment a lot sooner. We're also looking at technology that will help us identify individuals with liver disease, right? So not only do we have a lot of substance use disorder, but we have alcoholism in our community, and so having this equipment will help us identify those patients. We're also testing for hepatitis C, which is also a big health issue in many communities, not just the South Bronx. So those are some of the technologies that we're implementing now. We have quite a bit of AI in our electronic health record that helps us with summarizing previous visits so the doctor can get information quicker. AI that helps the doctor makes recommendations to the doctor on certain treatments. We're also looking at something that's really exciting, which is called ambient AI.
Ambient AI.
And this will allow, like we're having a visit, a doctor-patient visit.
Yeah.
And I can sit here and talk to you and look at you, and we can have our conversation, and ambient AI is taking notes, and it will create a note for me so that at the end of our visit, I can just review the note and sign it. So that saves me the time of, it saves me time because I don't have to do the note, but it also keeps me from having to look at my computer while I'm trying to talk to you as the patient. So that's something that we hope to have in place by the end of this year, which would be a tremendous help for the providers and the patients. The question is, is acceptance by the patients, right? Because, I mean, some patients may be fearful that we're recording them. And so we have to make sure we do it correctly.
I thought you were going to go on to say, I could be sitting here talking to you in your office, and the AI scanning you can, hey, doc, listen,
well,
you may want to check for this.
That's actually coming, too. There's actually technology out there. There's something I learned about a couple of years ago called a smart mirror. And you could have it in your home, and it uses some infrared technology to check your pulse, your blood pressure, your body temperature, and then it can send all of that information to your doctor without you ever leaving your bathroom.
Wow.
So there is that technology out there.
And AI that can get into iridology, checking, scanning the eyes to see what's, because people can tell, some of your ailments through your eyes.
Exactly. Yeah, diabetes, hypertension, we can check. I think AI is going to have a larger and larger role in what we do in healthcare, whether it's from helping patients make appointments to helping doctors come up with the right treatment for the right patient. All of these things are being developed, and I think that it's going to be larger. I think one of our concerns that we have to be aware of is that with all of this AI, that we don't use AI that introduces bias or disparities based upon the community that you're using it in. So that's something that we at Lincoln and Health and Hospitals are paying very close attention to when we implement artificial intelligence products.
Too intrusive. Wow, they know too much of my business.
Exactly.
Yeah. Healthcare is heavily regulated. How do you ensure that your medical staff is well informed about changes in the industry? The standards, the regulations?
So we have a whole department called the Department of Regulatory Affairs with the Director of Regulatory Affairs, and that's what they do. They monitor all these regulatory agents, whether it's CMS, Medicaid, Medicare, Joint Commission, New York State Office of Mental Health, New York State Department of Health, and we monitor changes in the regulations, and then we educate the staff, the clinical staff, and we monitor things that are being required to be monitored, right? So, and they're always coming up with something new for us to do. So the newest thing is, this thing called Diagnostic Excellence, which is a program hospitals will be implementing in the next few years, which will make sure that we identify missed, delayed, or wrong diagnosis in a timely manner, and that when we do have a diagnosis, we actually communicate that with the patient and the family in a timely manner. So I think these are good things. They're not bad things, but it just means that, we have more to do.
Yeah, and it's in the hospital, so you're checking yourselves.
Yes, exactly.
As the Chief Medical Officer at Lincoln, what are you doing to improve patient engagement and ensure that the community is educated about health and preventive care?
So we've been increasing our community outreach, right? So most hospitals, all hospitals. So we have our community advisory board, which is made up of people from the community that sit on various organizations. And we meet with them monthly and give them updates on the hospital. And then they take that information back to their organizations to spread the word. We also have a patient and family advisory committee, which is just what it sounds like, patients and families that come and tell us what we need to do as an organization, and a facility to take care of them. So that helps with patient engagement, getting them involved. And I think that there are, the community, like today, we're having an Easter egg hunt. And we expect, at the end of the day, 500 children to have come and had an Easter egg hunt on our lawn and have had a wonderful time. So doing things like that, letting people know that Lincoln is your hospital. It's not my hospital. It's the community's hospital, and we're here for the community.
I mean, it's so very important. Sometimes a patient feels all alone, you know. So when a family member comes in and gets engaged with the patient and the doctor, I think that's pretty helpful.
Oh, it's very helpful.
Yeah.
And we actually, not just families, but we're implementing a program where if you have not a caregiver, but a family member or a good friend, and you're hospitalized, that person can stay with you, right? If you want them to. So we're implementing that as well to make sure that patients have somebody to help support them.
Yeah, I think that helps out.
Yeah.
Helps with it's a part of the medicine
It is.
that you give. Lincoln is a public hospital, and sometimes the perception is that the care in public hospitals is not as good as private hospitals. Talkers out there, tell us why Lincoln? Why should people choose Lincoln to get care?
So I trained at Harlem Hospital, which was part of Health and Hospitals Corporation, and it was the best training that I received, and I think we provided excellent care, and this was way back when, and as they say, in the day of the giants, but not me, it was my teachers.
Yeah.
But I think that all of the public hospitals, and most of my career has been spent in underserved areas, working in safety net hospitals, and we all provide excellent care. We don't have all the bells and whistles that some of the other systems do, but we provide the same level of care. I'm convinced of that. I see it every day on a daily basis, and we just are there. We do get recognition, like we're emergency department is accredited as a geriatric emergency department, so we know how to take care of our older population in the emergency department. We are an advanced perinatal center for pediatric care. We're a pediatric asthma center of excellence. We have been a stroke gold center for 13 years in a row, taking care of stroke patients in the South Bronx. So, and we have many more, but we are really committed to making sure that we're providing the best care, regardless of the accolades.
Yeah.
We just want to make sure that we're giving the patients what they deserve.
And people will talk about that. Say, you know, I went to the hospital, and the relationships. That was a great night. I had a great nurse. I had a great doctor that took really, really good care of me. You know, people will go, they'll talk about it in the community. Oh, you got to go to see such and such. And they'll send them to Lincoln Hospital because of the wonderful things that you offer.
Yeah.
The wonderful care that you provide.
And that's what we want. And every morning at our morning huddle, we hear about the compliments.
Yeah.
We hear about the complaints too, but we also hear the
Oh, they're always
compliments.
going to be there.
which
You got
are-
the
which
this
are-
and the that, the
yeah,
yes and no,
yeah.
the good and the bad.
It's good to hear that people are recognizing that they're getting good quality care and that the people that are providing that care are nice.
Yeah. Any percentages, any comparisons, data?
We look at health grades, Hospital Compare, which compares us to state and national data in terms of the quality metrics. We compare ourselves to other hospitals within our system as well. My goal is, as the chief medical officer, is really to raise the bar, right? So what I tell our staff is that, you know, it's not good enough to be average. It's not good enough to meet the New York State average. We want to meet the top performer. That's where we want to be. And so how we get there is we work together to get there.
Working together, moving together in the same direction for a common cause.
Yes.
That's how we do it. Did we miss anything?
I don't think so. I think we covered quite a bit.
Yeah.
I'm sure I could sit here for hours and talk about Lincoln, but
Hey, bring the coffee in. Tell us about the outreach before we go.
oh, so some of the outreach that we do, and this is really something that I participated in last week. So we have a street health outreach and wellness van, and this van is staffed by a physician, a nurse,
Oh, wow.
a social worker, a community health worker, and we go out into the community and we park the van and we provide care. We give people, you know, snacks, socks, but we also provide direct care. So.
Yeah.
I actually participated last week on Friday, and the experience was phenomenal to go
I was going
out.
to say, when you're out there, I was wondering if we can come and spend a couple of hours with you on location.
Absolutely. I think being there in the community and seeing the patients, and some of these patients just need wound care, they need medication refills.
Yeah.
but they don't want to go to the brick and mortar hospital.
Yeah, they don't want to spend the
because
time
of
in the
some other
emergency room.
reason.
Yeah.
Yeah. So we can provide that in the street. And
Yeah.
so we'd love to have you come out and,
Oh, we would love that. Yeah.
and shadow us one day.
Yeah. I have 3 minutes left. What does the healthcare system of the future look like, and how can we begin building it today?
So I think it looks like more care at home. I think more artificial intelligence being used, like the technology that I mentioned, the smart mirror, using more of that remote patient monitoring, because taking care of a patient during an episodic visit to the hospital, you miss 99% of the patient's life and other areas that you need to monitor, right? So doing more at-home care, more remote monitoring, more artificial intelligence to help the patients, to help the families, and to help the providers as well provide care. But I think that's where we're going.
Yeah. Yes. Doctor, thank you so much. We appreciate you.
Thank you, Dr. Lee.
You can come back again, all right?
Thank you. I love
Yeah,
it.
for sure. Thanks, everybody, for watching. And remember, you can always watch Inside Lincoln Hospital, the heart of the Bronx, anytime, anywhere on BronxNet.org and YouTube. And while you're there, be sure to follow BronxNet and Lincoln Hospital on social media to find out who's coming up next. From BronxNet's Media and Technology Studios in the South Bronx, I'm the Dr. Bob Lee along with Dr. Lewis Marshall. I'll see you the next time. Catch you another day, another way, inside the Bronx. Take care. I love you all. Peace.
Go, go, that's a good catch. Come and go, 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 that was a good catch. Go, 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 that's a good catch. Go, go, that was a good catch. That's a good catch. Come and go, 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 go. That was a good catch. Go, 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 go. That's a good catch. Go.